We just don't have time to waste time. We have a couple of weeks left here. Obviously, it does require bipartisan support to get out of the Congress, but it requires a presidential signature.
That's Mitch McConnell referring to the new $900 billion stimulus bill that's bipartisan, but he still says it's a waste of time. Now, I want to show you what McConnell cannot waste his precious time on. Money for small businesses, state aid, supplemental unemployment benefits, cash for schools, infrastructure assistance for struggling renters, and so much more. Instead, McConnell wants a slimmed-down plan that is focused on small business loans, money for vaccine distribution, and a broad liability shield for businesses, which Democrats are opposed to. Now, joining us to discuss the stimulus stalemate plus the COVID vaccine is Congressman Raul Ruiz. He's a Democrat from California. He's also an ER doctor, and we'll be talking about the vaccine shortly. But Congressman, I've spent so much time here showing real people struggling in real time, and Washington hasn't come through. And I know you guys more than 5 months ago passed a bill that would have gotten stimulus aid here, but still it's sitting stagnant on the Hill. First of all, are you optimistic, as some of your colleagues are, that something's going to get done before the break? And if you are, what do you think it's going to look like?
You know, Richard, thanks for having me on the show. But first, let me tell you that I am cautiously optimistic. And the reason why I'm cautiously optimistic is because this is in the hands of one person and one person alone, and that's Mitch McConnell. As you just heard, he said that it's a waste of time. And it is not a waste of time for the American families who are struggling, who are on the verge of being evicted, who have lost their job and are barely making ends meet, if they're making ends meet at all. So it's very difficult to predict what Mitch McConnell will do. What he is addicted to is his own power, and he may lose that power if he loses the Georgia races, the Senate races, and therefore I think that he may want to come to the table in order to keep his own power as leader of the Senate by passing a stimulus package that will help Georgians and therefore make the case that that they need to vote Republicans. But we know that Democrats have voted for a stimulus package months ago, and we did it again with a different version to try to get more Republicans on board. And we definitely need to make sure that the next package is done right.
So clearly McConnell's got a calculation on his mind with those two Senate races in January in Georgia for the balance of power in the Senate. But Democrats have a calculation too. And it seems that President-elect Biden is saying, listen, something's better than nothing right now. We got to get money into the hands of the folks at home. But that somewhat presumes that there's going to be more money to come. And I don't have to educate you. I mean, Washington can work on its own timetable, but take California. In Sacramento, the governor and the state legislature, they got to pay the bills. So if they don't get state aid, they're going to be taking an axe, not a scalpel, to their budgets. How confident are you that this is a down payment, but more is to come from the federal government? Or is McConnell off the hook? He writes one package, and then after January, you're on your own.
Well, you know, if you look at previous behavior, the latter is more accurate, where he passed the CARES Act in the Senate and got it to the president's desk and pretty much wiped his hand from any further responsibility. So we have to make sure that whatever comes in aid for the American people, that it has state and local aid, that it has another round of stimulus check for families, that it has unemployment insurance extension, that it has monies for the vaccines, monies for school, monies for small businesses. You know, you don't want to offer somebody a car with only one wheel. And Mitch McConnell's lacks several of those, his proposal lacks several of those provisions, including the state and local aid that helps pay for firefighters, for teachers, first responders. So it's Mitch McConnell who is leaving them out in his aid, and that's why if you're going to do this, you got to do it right. You got to give a car with all four wheels, and those four wheels include all those provisions that I mentioned earlier.
Speaking of the vaccine, and not just the economic hardship it's caused, but you're an ER doctor. I'm curious your perspective on this. Last night I opened up the phone lines. And, listen, I'm a big personal liberty believer here, and I'll fight with anyone to protect a lot of the protections that we've been afforded. But Right now, less than 60% of the American public, if you believe the polls, are going to take the vaccine. And to me, if folks like yourselves or people that are fighting on the front lines to do this and all the other businesses from restaurants to everything in between really can't open in full until everybody takes the vaccine or enough to get herd immunity, then I'm sorry. If somebody's choosing not to take it, I'm not going to force them to take it, but should they be able to get on a plane? Should they be able, to go to a ball game and sit next to me or my family? Should we restrict rights of people? And I know it's not a federal, but it's more of a state or municipality, if they're not willing to follow the science and the medicine of this for the betterment of this country?
Well, we implement safety, public health laws, and people have the choice to follow those laws or face the consequences. For example, seatbelts. People thought it was a violation of their rights to ride in a car without a seatbelt. Now people understand that if they wear a seatbelt and they insist that others in the car wear seatbelts, that they will more likely survive a car accident, and the other person in their car or in the other car will also more likely survive in a car accident. So now everybody accepts that if you don't wear a seatbelt, it's still your choice, but if you don't, one, you can die, and two, you can get a ticket from a police officer. So same with this vaccine and the masks. For example, the vaccine is not going to end the transmission of the virus. It will prevent the individual who gets the vaccine from potentially getting the virus and getting sick from the virus. If people wear masks and keep their distance and wash their hands, that will be a more immediate, more effective way of reducing the transmission. Yes, we need herd immunity, but herd immunity doesn't mean the eradication of the virus. It just means that the transmission will slow, but it will still be there, and the people that are not vaccinated will be most at risk. I don't necessarily believe those polls that when it comes down to actually administering and getting the vaccine, that people will not be wanting to get the vaccine at a large number where we won't be able to reach herd immunity, because people are just tired of this pandemic. People are tired when they want to go to work and they realize that they can go to work and be more at safe, or their employee is telling them that where they're offering the vaccine so that they can go back to work, then I think people's minds will be encouraged to get the vaccine, especially when we know that by following the public health precautions and getting the vaccine, the sooner we'll be able to go back to work, our kids to go back to school, and the better protected everybody will be from this virus.
Now, I know you're working really hard behind the scenes to try to get this vaccine to the public, and to not just, the folks on the front lines, the essential workers, but also to a lot of other forgotten communities. To that end, how confident are you? And I remember when we had this problem, Congressman, with PPE and with ventilators, it was almost every state they were on their own. Not every state is equipped for refrigeration or for storage, et cetera, as another one. Are we going to have a problem where 50 states have 50 different capacities to handle the vaccine? Or should I be comfortable that this is going to be run from the CDC and everybody's going to be treated the same?
We are going to have a problem, Richard, and we all should focus on how we're going to administer the vaccines in the hardest to reach communities. The first thing was to create the criteria of a public health equity approach to determine who will get the vaccines first. And CDC rightfully designated healthcare workers who take care of COVID positive patients to be the highest risk of getting infected. Therefore, they should get it first. 40% of deaths are from seniors in long-term residential care, because most likely they have chronic illnesses and are debilitated and they live in tight quarters. Therefore, they should also be considered in the top priority in order to save lives because they're at the highest risk of dying, seniors with chronic illnesses. But it's not just a matter of putting the correct list on paper. It's also about the distribution and making sure that those that need them the most get them in their communities. But it doesn't end there, Richard. It also is about the administration of the vaccine. Look, I went into the community and trailer parks after the H1N1 pandemic as an emergency physician, public health expert, vaccinating the highest risk farm workers in my community. I'm doing the same with COVID testing here because I realize that relying on the current system is going to lead to failure and is going to mimic the health inequities and disparities that we've already seen. We have disparities in death from COVID-19 because the system is set up to fail those communities that face health inequities. So if we just rely on the resources and the apparatus and the clinics that already exist, then we're not going to reach the highest risk communities. That's why we need to look at logistics. Do poor communities have the capacity and enough nurses and doctors and healthcare professionals, which normally they don't, to go into the community and inoculate their population? Do they have enough electricity, enough refrigeration to keep the Pfizer vaccine at sub-zero temperatures for a long period of time? Do they have the resources to do a outreach program in the places of employment, in churches, in trailer parks, in low-income housing, in other locations to really capture the high-risk population and offer them the vaccine? Or are we just going to rely on the highest bidder or those that are rich and powerful who have access to these resources to get them first? So these are the questions that I'm going to be asking, that I'm going to be vigilant on, because I believe that in order to get this pandemic done with as fast as possible, we need to take a public health equity approach and really provide support for those that are highest risk of getting infected and the highest risk of dying from COVID-19.
Finally, before I let you go, you're a congressman, but as I mentioned before, you're a doctor as well. How worried are you as to how bad, even as bad as it is, this is going to get here about a month from now, once the cases that come from Thanksgiving and then you get the holidays at the end of the year? How stretched beyond capacity will hospitals get is your fear?
Well, we have some things going for us right now, and that's that we have some experiences with surges in different areas of our country, and we also have better knowledge of treatment. So we're able to provide treatment and care in the hospitals where we can prevent a hospitalized patient from going into the ICU and taking up a ventilator. Having said that, we know that this is a war, and we're approaching the last great bloody battle that is going to push us to our limits. We're going to see things that we've never seen in our lives, in any previous recent generations, because of the fact that we are already at record hospitalizations. We are already at a point of fatigue and breakdown with our personnel, doctors and nurses and respiratory techs who haven't rested at all since this began. And so we are going to be really stressed, really pushed to that limit. But the good news is that come spring, the vaccine is going to help. But this isn't a time where we lower our guard thinking that things are going to be fine, because we're going to start to see the vaccine's effects in the spring of next year. It's like running a marathon. You just got your butt kicked for 19 miles. Now you see the finish line. Is this the time for you to slack, or is this the time for you to focus and get across that finish line? This is our time to focus, because we know the hardest part is coming this winter and the early next year. So this is the time to make sure that we follow all the precautions to get over this last hump, this last surge, this last great bloody battle, because come mid next year, we'll start to see some positive movement in this pandemic.
Well, Congressman, I know you got a really important month ahead of you there in the Capitol, and I certainly appreciate you giving us a few minutes today. Thank you so much.
Thank you.
All right, folks, when we come back, how the Republican Party and the right-wing media are not only enabling this president, but also the dangers involved in what they're doing. That and more after this.